My name is Dan Claypool. I'm one of your county commissioners, and on behalf of the Board of County Commissioners, we want to welcome you here today. We really want to thank you for taking the time to come and listen about this really important topic. Between the federal government and the state, I think they have really, really complicated this matter. Careful. I am, and that's why I say careful. You know, I was careful the way I said that, because there could have been a lot more criticism on that. I was just telling a gentleman, really and truly, you know, as important as health care is to everybody, as important as what that is, this program's been in effect. We knew it was going to go in for 3 years. How it could be so bungled, I'll never know. But it is, and they're fixing it. And we're going to learn about it today. And hopefully they're going to be able to walk you through so you can get the services that you truly need. Because that's what it's all about. That is truly what it's all about. And like I said, everything you hear out there, everybody's got a side, everybody's got a story to tell. But I do have to tell you this. You hear everything about this healthcare.gov, and you can't get out there, you can't do that. You know, I did. I went out, I got on it, I walked right through the site, they walked me right through. I didn't have one problem. Not one problem. So maybe I'm special, I don't know, but it worked. So that's why we thought it was so important that you come here and you listen and have people help you walk through this process, because it is complicated, and I think there's people out there trying to make it more complicated for whatever agenda they may or may not have. So when we get done today, we brought people in that we believe can answer your questions, can help you through, and that's what it's truly all about. So with that, this is put on with the cooperation of the Ashtabula County Senior Levy Board. Now, I don't know how many of you know about the Ashtabula County Senior Levy Board, but the voters in Ashtabula County have been very, very gracious to the seniors that back in 2000 approved a 1 mil levy for senior care services. And the commissioners have a senior levy board made up of about a dozen people that come together and administrate this levy to provide the services, the critical services that our seniors need to survive in our county. And we're going to get a little lesson in that real quick by our chairman, Paul Fuller, who's going to tell us a little bit about the levy and some of the services that it actually provides. And also joining us today is going to be Gail Justice. This is the open enrollment period for the Medicare Part D, and it ends December 7th. So Gail's going to explain how the prescription assistance program can help you and take some of this confusing paperwork and maybe simplify it for you so you can get together. Because the commissioners have gotten a number of calls. Has anybody got this letter about this Medicare Advantage and that they're canceling it? You know, it becomes real confusing. They say there's no doctors, no hospitals that will, in Ashtabula County, that will accept this. And that's just not true. We checked in university hospitals, and all their doctors are under contract with Medicare Part D. And I'm sure the Cleveland Clinic did the same. So again, you know, if you got this letter, talk to the people that we have coming in here today to help you through this process. I'd be really negligent not to thank our Department of Job and Family Services. We have the director here, Patrick Arcaro, and Martha Gillespie, who does the senior services part in her job, and I want to thank them both. Let's give them a big round of applause. So before I go on, I'm going to turn this over to Mr. Davis. I want to introduce my favorite state representative, John Patterson, representative of the 99th District here in Ohio and for Ashtabula County, the northern part of Ashtabula County. I'd like him to say a few words.
Thank you, Commissioner Claypool. Always a pleasure to be with you, my friend. And the reason I was kind of giving him a hard time about, so be careful, the state Medicaid expansion hasn't quite gone online yet, so we've got a grade A right now. The feds have some problems, we know that. We're working on it, but we're good. And what's that magical date? December 9th. December 9th. So we're going to make sure that works for the state government. I'd like to thank you guys all for coming out. This is a great event, and looking forward to the knowledge that you're going to gain from this. I want to let you know, and I thank you for driving up to Columbus. Welcome to my world, the 71 to 71 experience to North. And it's not snowing for you today. That is nice.
Yeah. Tomorrow might be a different picture.
That's Saturday. But just to let you know, I have the longest commute of anybody in the House of the Senate. So I understand what you did today, but we thank you for coming up, and thank you for hosting this. If Medicaid expansion would have come to a vote in the state legislature, I would have voted for it, because it was the right thing to do. Ethically, morally, especially with the circuit breaker approach that if the federal government did not uphold its end of the bargain, first 3 years, 100%, and then after that, 90%, the feds are going to come up with, and then the idea is that we can bend down that curve so that it's essentially self-sustaining. But there are close to, correct me if I'm wrong, almost 300,000 Ohioans who are going to be directly impacted, about 275,000, and about 6,000 right here in Asheville County. So it was an idea whose time had come. We never got that opportunity, and you're going to hear about this and be alert to it. Because it never was voted on in the House, it went to this obscure, formerly obscure, board known as the Controlling Board, 7 individuals who actually verify and authenticate money that is spent in Ohio. In this case, the federal government had already set hundreds of millions aside. They just needed an account to put it into in Ohio, and that's what the Controlling Board did. Now, the groups, the coalitions who opposed expansion are challenging the constitutionality of the Controlling Board to do what it did. So keep your eye on that, but we have to still move ahead because this is a law. And just be careful and keep a pulse on all this because it's a moving target. So again, I want to thank you for putting it on. I'll get out of the way. Thank you for being here. And if you have any questions, I'll leave some of my cards back on the table there. It's a pleasure, a privilege, and I'm humbled to be your servant in Columbus. Thank you. God bless and have a happy Thanksgiving too. We have much to be grateful for.
I would like to introduce the chairman, Paul Fuller, of the Senior Levy Committee, and he's just going to touch on some of the services. I don't know as though everybody really, maybe you're getting some of those services, but some of the services that are available to you through this levy, and it is so important for the seniors of our county to maintain this levy. So, Paul, with that. He tells me he'll keep it less than 25 minutes, so that's all we blocked out for him. No.
I will keep it brief. He really didn't come to listen to me. We did want to, we're proud to be a sponsor of this opportunity for you to receive information about the Affordable Care Act. I would note that, the confusion, the difficulty, the challenge of affordable, accessible health care has been around for a long time. Some 15 years ago, some citizens of Ashtabula County were concerned about this, particularly as it affected senior citizens. And they determined that we should ask the voters of the county to approve a levy to support, among other things, helping seniors access affordable health care. And so in 2000, the ballot issue appeared and was passed by Ashtabula County voters. The voters approved and passed the first Ashtabula County Senior Services Levy. It's a 5-year, $1 million levy that generates approximately $1.5 million per year. The Board of Commissioners asked the Department of Job and Family Services to administer this levy, and they do that. They also felt it was important to have public input on how these dollars were spent in the community. And so they have appointed, as Mr. Claypool said, an advisory board. I'm currently serving a second term as chairman of that board. But that board, as Mr. Claypool said, consists of approximately 12 individuals, volunteers, who meet regularly and wrestle with the challenge of using this money, these county taxpayer dollars, to address the needs of senior citizens in Ashtabula County, those persons age 60 and over. One of the other things that was paramount in this levy is helping the public understand how these dollars would be used. And the result of that has been an annual report. There are copies of this report on the table behind you at the entrance. It does a very good job of explaining the services that are delivered, and by the way, delivered in every township in Ashtabula County. They tell you how those services are delivered, which companies, which vendors, which private providers are delivering those services, and how much money they receive for delivering those services. In other words, we believe there's good accountability about the use of these dollars that taxpayers furnish for senior services. Excuse me. This is the color. You see this. Ashtabula County has supported the senior levy. We ask that you continue to support this levy. When you see this yellow and black logo, that you understand that that's your tax dollars at work locally. In the spirit of Thanksgiving, I would have to say again, thank you to Representative Patterson and Senator Farrell, who couldn't be here today, for their support. The county commissioners for their ongoing support daily. The commissioners attend the advisory board meetings. They ultimately approve any of the recommendations that the advisory board made. And they have resulted in the delivery of services in Ashtabula County. So we ask for your continued support. We thank you for being here. And in spite of the frustration and difficulty understanding this stuff, understand it's been here for a while. We'll get through this. We hope that it'll get better. And again, working toward the goal of affordable, accessible health care for the citizens. Thank you very much.
Okay, with that, I'm going to turn this over to Mr. Davis from the...
Mr. Berta.
Oh, I'm sorry, Mr. Furner from the Ohio Extension.
Ohio Association of Food Banks.
Okay, sorry. Sorry. I got to read this thing.
Rough crowd.
But thank you for coming, and it's all you.
Okay. So like I was saying, I'm from the Ohio Association of Food Banks, and I'm here to talk about the Affordable Care Act. Just going to click that. And I just want to let you know all the information providing is the most up-to-date and accurate information there is. Now, there's certain little things that may change, but the core values will stay the same. If you have any questions, we're going to kind of wait to the end since the crowd's so large, but I will definitely answer all your questions. Now, the point of this is just to be affordable. It's supposed to be a higher quality and more cost-effective. And it's actually causing these insurance companies to have competition with one another that save us money. Of course, there's many different ways to get insurance through your work, Medicaid, CHIP, Medicare, VA, TRICARE. You can get individual mandates or exemptions if you have, of course, financial hardships, if you don't make enough to actually file for taxes, if you're incarcerated, undocumented, and if you have religious objections. But basically, it stops the denial of coverage and eliminates higher premiums based on gender. And this really affects women, because women overall have always paid more for health insurance. And sadly, especially women who have been victims of domestic violence, it's either been considered a chronic condition and they've been denied coverage, or they have to pay so much more than anybody else. So that's finally over. The young adults, we've actually extended it more in this state than any other. You can now stay on your parents' insurance up to the age of 26 all over the country, but now it's at the age of 28. That's in Ohio. And what's really important is this helps 3.1 million young adults gaining insurance, and 97,000 of them are in Ohio. Like I said, it ends discrimination based on pre-existing conditions, eliminates co-pays for preventive care such as birth control, mammograms are covered. There's a lot of just regular maintenance that is covered within these plans. No more can they have limits. So if you go to the hospital 10 times, they used to be able to kick you off and say you hit your limit cap. That's no longer an issue. It requires a summary of benefits. It's now easier than ever to see what your coverage is. Before, they used a lot of information and lingo, and they would have all these loopholes. Under this circumstance, now it doesn't apply. That's no longer the case. It's an easy apples-to-apples comparison. You can see what plans, what they give you, what they don't give you, and then easily compare it to other plans. And prevents loss of coverage, limits out-of-pocket expenses, and just sets up an essential health benefits. What that means is it's basically a consumer bill of rights that every plan must have. Eliminates copay for Medicare, covers preventive services. Another interesting thing is covers preventive services for seniors. Bless you.
Thank you.
And people with disabilities. The focus now is working on not waiting until you're sick or something's broken to take care of yourself. With regular maintenance on a car, it saves you money in the long run. That's how healthcare is now being focused. Hence, one of the requires chain of restaurants now to post nutritional values. Now, I know no one likes to see that, but it's good for people to know what they're actually feeding their kids. It's trying to be more health conscientious and just live better lives. It's got three main focuses: improve affordability, improve the overall experience dealing with the healthcare system, and of course, improve the health of the population. With the administrative simplification, what that basically means is now all these systems are integrated. You can, when you put your information in, it bounces with the IRS, it bounces with Homeland Security, Social Security. And it makes sure that you're actually who they say they are, so no one's using your insurance, illegally. Prevents waste. A lot of times you go to the doctor's office and they give you, you do a blood test. They check your blood, but then you go to your specialist, they check your blood again. They charge you twice when the results are the same. But now the systems will be able to see, okay, well, Dr. A did this, and here's your results. It really cuts down on waste and fraud and saves money in the long run. All right, now this is the federal poverty guidelines. This is basically a chart. We'll have some in the back. And you can see where you fall on this scale. Now, 100% is actually at the poverty line. At 138 and everything, my right, your left, that's going to fall under Medicaid. So everything on the right is actually what is in the marketplace. Anything beyond the 400% of the federal poverty guideline is actually going to be private insurance. This, of course, is excluding if you already have insurance through your work. And I need to make one thing clear. If you have Medicare, this doesn't affect you. So that's something that's really important to consider, or VA care, any of that. This is just another way now to look at the chart we showed you earlier. This right here, that's the gap for Medicaid. Now that coverage gap was childless adults who have normally never had coverage because they couldn't get Medicaid and they couldn't afford, comprehensive insurance. Everything between the two lines in the orange, that's now what the marketplace covers. And again, private insurance exists above that. Okay, we've launched a new site, benefits.ohio.gov. There's a lot of information, a lot of things you can find out if you're available for. It's got a lot of information and benefits, and a lot relies on electronic information. Again, you can find what you're looking for, you're at the right place. It doesn't let you get lost and apply for things that you can't apply for. Basically, just a new way to buy health insurance. That's what the marketplace is. It provides access to affordable coverage. It applies not only access to affordable coverage, but fair coverage. No longer is there discrimination there. And again, that apples to apples comparison. We'll have a little video playing where you'll see exactly what I'm talking about, so it's more concrete. Effective dates. We passed the October 1st, of course. Now the second one is the next important. If you sign up for health insurance, you have to have your first premium paid to your insurance company by December 15th to immediately start the coverage January 1st. And of course, enrollment ends March 31st. Now there are special events. If you lose your job and you lost your health insurance and it's after the enrollment date ends, there's these life events we call, where it'll get special open enrollment. So if you have a kid, you get married, there's a death in the family, you'll be able to then re-enroll and change your plan. We've really cut down again on the waste, and we've simplified the process. Just tell us about yourself, your current job, income information, the health coverage you currently have, if you do have some, and then sign and submit. They're no longer allowed to ask you about your past history. Technically, insurance companies right now aren't supposed to ask you any information about that, but some are trying to sneak in as much information before they legally can at January 1st. So you might talk to someone, they'll have to, oh no, you have to tell us information still. They're lying. You don't have to tell them anything. The only question they can now ask you is if you smoke, because that's a choice. One of the things that's important is to live in the service area. You can't buy a plan that's only available in New York City for here. That's to be in your coverage area, of course, be a U.S. citizen. You can't be in jail. Okay, again, Medicare is not part of the marketplace. You have Medicare, you're covered, it doesn't affect you. We're really emphasizing that because there's a lot of, let's say, misinformation going around. And I also want to say on a side note, I signed up a bunch of people yesterday. Website's working. It's fine. Never had a problem with it. So just turn off the TV and zone all that out. All right, the plans on the marketplace are called qualified health plans. That means they've been approved. The issuer, this has to be licensed by the state, and it's a good standing. It has to cover the essential benefits, which I'm pretty sure is the next slide, and we'll go over that. And they have to at least offer at least one silver plan and gold level plan. Again, we'll get into that. And the issuer has to promise that if I offer a plan on the marketplace and I offer it privately, I can't change the rates. I can't punish you for using the marketplace and make it cheaper if you go to me directly. So it has to be equal no matter what area or how you obtain the coverage. Okay, these are the essential health benefits. Now, every plan must have these. Anything else the companies offer is just a way to sway you to buy from them. Ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services, prescription drugs. Those are on there. They all have their own plans, and it depends on what you get, but they all have prescription plans. Laboratory services, like I was saying, blood work, urinalysis, preventative and wellness services that help you manage chronic disease, and pediatric services if you have a child with oral and vision care. But that's only for kids. Okay, like I said, might cover more than the essential benefits. And certain plans will have certain providers. Some will be HMOs, some will be PPOs, which lets you pick, even if you're not in the network. If you go out of network with a PPO, you might pay a little out of pocket, but it's not like an HMO where you're paying fully out of pocket. So those are certain things to look for when you look at insurance in general. Premiums, copay, and co-insurance will be different. You'll see multiple plans from multiple companies in that area. And it just varies on what's going to work for you the best. And again, they'll be structured differently. We're going to get into that, but some will have higher deductibles and then lower premiums. You know, high premiums, lower deductibles, or out of pocket. It's all going to vary. Here are the levels. Now, there's actually a fifth one, but it's catastrophic, which we will get to after this, but we call this the Olympics. There's bronze, silver, gold, and platinum. And this is after you pay your premium and after you hit your deductible. The plan will pay 60, you would pay 40 out of pocket for the bronze, and vice versa. So the more you use the hospital services, well, if I get platinum, if I need to go to the hospital a lot, it'll make my out of pocket so much cheaper. And I'll probably already hit my deductible, so that's not the problem. but my premiums will be higher. But overall, that will save me money. It's just based on how much you use it. Someone like me, you're probably gonna go bronze or silver. You know, but if you have a chronic condition, I would suggest gold or platinum, because being in and out, you want to pay less out of pocket. But basically, it's customizing it to your experience and your needs. It's not just a broad plan that you just got to roll the dice on. Catastrophic. These are for the young adults under the age of 30. We call them the young invincibles. They don't think anything's ever going to happen to them. And you know, they have really high deductibles. And I mean really high deductibles. But they do have some primary care visits built in, but these are for people who, they don't think they'll ever use the insurance, but worst case, they technically have some. But like I said, the premiums are quite steep. And there is financial help. I know there was a lot of plans released initially, and people were looking and saying this isn't affordable. Well, those plans were not with the tax credits that are built that you will get based on your income. It just looks at your income. It's actually what you file for taxes. If you file jointly, it looks at you jointly. But it also works toward the area. With the reduced cost sharing, the silver plans is what we have, or basically what we call a benchmark. Based on the area's economy, it's a sliding scale that makes it focus. So silver plan here is going to cost different than the silver plan in Columbus. But with the sliding scale, it makes it affordable for everybody. And again, it's based on the economy of the area. And I'll show you the tax credits later, so you'll get to see and experience what that is. But again, eligibility is based on household income between 100 and 400, or the federal poverty line, depending on where it is. Of course, you have to get the qualified health plan through a marketplace to see the tax credits. That's why those plans earlier, they just took them off the internet. You have to go through the marketplace to actually see what credits you will be getting. And ineligibility for government-sponsored coverage and insurance. So if you have some government plan or something through that, you're not available for the tax credits associated. And premium tax credits is going to depend on your household income again. Like I mentioned before, the premium for the second lowest silver level plan is the benchmark. Most people are going to go to a plan around that. So because the risk pool is so large, the insurance companies can then separate the risk and give you a better deal on the plan. So one of the places I was at, silver level usually pays 70-30. But the area I was at, because so many people were around that silver level, it was actually paying 87. It's going to vary. It's not always going to happen, but it all depends on the area. Okay, you can basically, when you get your premium, when you put in your financial information, it's going to say, here's your tax credit. Here's what it is monthly if you want to put it towards your premium, or here it is as bulk if you want to wait till the end of the tax season and get it back on your taxes. Most people are putting it toward the premium right away, but you have that choice. And it just makes it much more affordable to get a plan. But again, you get changes in circumstance, new family members, increased income. When you create the profile, you can edit it anytime. So if you initially think, okay, based on my taxes last year, I'm going to come in at this, but you end up going higher. Well, technically your credit should be lower, but you don't pay it or you don't change it online, you're going to have to reconcile that at tax season. Or if you come in much lower than your income, go online, change it, and it'll adjust your premium tax credit so you can pay less for your health insurance. It's very malleable in that sense. Okay, eligibility for reduced cost sharing. Income's out of below 250%. You can get some more credits on top of the ones you already have. That's again running with the silver level plan. Okay, don't ask why it's called SHOP and the B is underlined. I didn't make this slide. But basically, this is how small businesses can help their employees get health insurance. It's a streamlined way. It means anything less than 50 full-time employees. That's what the FTE means. Or you have 50 part-time employees. Every 2 part-timer equals 1 full-time. So it's again a way to look at it. It is part of the marketplace, but you will be referred to a different area if you are an employer, or once you enter your employer information in, if they have a health plan available, it will transfer you to that area. Now, the only time that you can, if your employer pays for your health insurance or they offer a plan, the only time you can then, I say, negate your employer's plan and try to shop for your own on the marketplace is if any of the plans are if the lowest plan on there is 8% or more of your actual income, then it's negated and you can shop somewhere else for health insurance. But even if you go on the marketplace and it's 8% or more, that's when you'll be transferred to Medicaid or something else. That's what I said. Okay, so it's fewer than 25 full-time employees. These are extra TED credits you can get. Their employees' wages average less than $50,000 a year, and you're a business, you help your employees get health insurance, you get more credits. Buy health insurance to the shop only. If you pay $35,000, you get 25% credit. So there's a lot of incentive for employers to help their employees pay for their health insurance. All right, this chart basically shows whether you're a person or a family or a small business, you go into the website and it bounces information through all those different servers, and it'll kick you to where you need to go. So you're not applying for something that you can't apply for. So again, that cuts down on waste, response time, everything. So you go, it might get to Medicaid or CHIP or the QHPs, which is the marketplace, or shop. And basically, it's just an easier way to shop for health insurance. Because we're approaching the insurance companies as a group, we can then negotiate the rates. Where in the past, the insurance companies would say, all right, well, if you go to the emergency room, that's $75 for an aspirin. We've all heard those stories. Because we're approaching the insurance companies reasonably, and as just a larger group, it dispenses the risk, and now the prices are actually what they should be instead of them having those outrageous ones. Which again, cuts down on the cost of health insurance in general. This will actually save money, despite what you've been hearing. It's not going to bankrupt us all. I want to throw that out there. That's personally. Most people will be able to get a break on cost, if not free. And again, the clear apples to apples option, you can really see what you're getting with your plan. Okay, but of course there's a 24/7 marketplace number. This is if you're at home and you check out your profile and you need help walking through it. You can call them, let them walk you through it. Of course, when you go to healthcare.gov and marketplace websites, there are links to find places in your area, like a health center, where you can go in anytime for free. Well, not anytime, if I'm not open, obviously. But anytime, you can go in there, sit down, and they'll walk you through the process. And it's completely, they can't tell you, they're not going to have a bias toward one company or another, but they will sit you down. The certified assistants, I'm a navigator, so not only do I help people sit down and enroll in health insurance, but I do informational sessions like this. I'm actually state and federally certified, well, state certified, federally funded, I should say. Whereas a CAC, or a certified application counselor, they're the people who are at those health centers. They are very well trained. They don't conduct outreach like I do, though. But these are the people who have just as much training as I do and who will walk you through the steps. Agents and brokers, it's a completely different category in the sense that those are people who work for the insurance companies. And with them, they're going to have a biased opinion. Whereas I can't say, ooh, I prefer Anthem or MedMutual. You go to an agent and broker, you're not going to go to a Honda dealer and they show you Toyotas. So they're going to show you what's in their plans. But if you like your health insurance company, you can go there and find the best plan for you. I mean, they're very knowledgeable, but they do have a biased opinion. And I literally just explained what that is. This is the consortium. We were given a grant to do outreach to help people sign up for health insurance. These are just our friends. These are many people that we had shared the grant with, and they're all over the state. And you can go in, like I said, sit down, and they'll walk you through the steps. And again, these people are called CACs, or certified application counselors. Are good there. And again, agents and brokers. Okay, Ohio for Health. This is a website with lots of information. You can redirect it to healthcare.gov to enroll yourselves, get informed for information. You can actually put in information or like where you live and see events by you, whether it's an enrollment clinic, whether it's an informational sessions like this. Find calendar of community events. Just really informational. It's a lot of help. And if you have any questions, it has a lot of information for you. And again, just things to get ready. So if you're not sure, if you're not ready to sit down and buy health insurance without someone to help you sit down and go through it, create at least an account at the marketplace. It's very simple. Like I said, I was just doing it yesterday. I know there were some hiccups initially, but that was also because 46 million people clicked login at once and broke the internet. I mean, that's a lot. And there were some hiccups, but like I said, it was working terrific yesterday. And you can learn about different types of health insurance available in your area. You know, find the right cost and what you're looking for. Now, if you do go on the website and don't open your profile and look at the plans in general, you will see plans on the website that don't have your premium counted. So think about that. But there is a link to the Kaiser Family Foundation calculator where you can go anytime, put in your information, you can see what your premium, a good estimate of what your premium will be. And it doesn't save any of your information, but it's available free on that website. Take a list of questions of things that are important to you, whether it's your doctor, whether it's your hospital, whether it's, you know, you really need to make sure focus on your prescriptions. There's just a lot of things that you know that you need to have on your plan. And the worst thing you can do is sign up for insurance and go, I should have asked that question. I should have brought that up, or I was looking for something. Take a week. Write down what's important to you so you know what you should look for when you finally take a shot. Make sure you just understand how insurance works. Premiums, copay, deductibles. Make sure you understand the language, because even though it's been made a lot simpler, there are still just standard words and usage that they use. And if you don't know, ask someone. We're here to help. Start gathering basic information again on your household and also your budget. Make sure that you know what you can afford, the max, the minimum, and anything in between that you're willing to kind of give on or you could give on to make your health insurance what you want it to be. Also, find out from your employer. Maybe they already have a plan on the marketplace. See what help they do give or might offer. And if they don't know about the tax incentives, just, you know, let them know. Ask them if they do know. And they might actually help you get better health insurance. But also explore your current options. If you have health care now, contact your company. They'll definitely have a list of plans for you that they're going to probably offer on the marketplace anyway, but they can subvert all that and help you out directly. I have no doubt they will. Now we're about to watch a video, just in the bottom left. There you go. And this is going to show, we have two videos, they're very short, and they show how to navigate the website and gives you a good idea of what you're going to experience.
Welcome to the sample application for the Health Insurance Marketplace on healthcare.gov. Here, individuals and families can explore health coverage options and opportunities to get lower costs on monthly premiums. Individuals can submit applications starting October 1st when open enrollment begins. The application features dynamic messaging to answer consumer questions, to guide them through the process, and to encourage them to apply. This online dynamic tool will enable applicants to complete one application for enrollment in a qualified private health plan, the Children's Health Insurance Program, and Medicaid, and determine if you're eligible for lower costs on your monthly premiums. With integrated electronic verification, applicants can get health coverage and be matched with programs to help make that coverage more affordable. To demonstrate, let's look at the application process for a fictional single man from Arizona, William Doe, who is looking for health coverage just for himself. William will fill out the application online to apply for coverage. Before beginning the online application, William will create a user account. Then, from his account, he will access the application. The privacy and use of your information page lets William know how the information he enters will be used, and that data from other sources will be accessed to verify his information. Integrated systems will check his eligibility by retrieving information from other federal agencies to verify responses and provide real-time answers. Personal health data is not stored. On this contact information page, William answers a few questions about his home and mailing address, his contact phone numbers, the the language he prefers to speak and read, and how he wants to be contacted by the marketplace. This information is not shared with any external party. William has the option of naming someone as his trusted representative. This person would have permission to talk to the marketplace about William's application and sign William's application on his behalf. William declines this option. William is only interested in getting health coverage through the marketplace for himself. So on the "Who are you applying for health coverage for?" question, he selects William Doe. William checks yes to see if he is eligible for paying for health coverage. William isn't adding any family members to his application. If he changes his mind, he can add additional family or household by clicking Add Another Person. In the next section, Family and Household, applicants can apply to get help with health insurance costs. In the William Doe Personal Information screen, William enters his personal information. Then he completes a series of questions about his household and how he files taxes. Here, William has the option of providing his race and ethnicity. William needs to answer a few additional questions that could determine whether or not he qualifies for additional assistance or certain protections. Here on the Family and Household Summary screen, William has a chance to review his answers and make any changes. Eligibility for financial assistance or for Medicaid or CHIP is based on income and household size. On the income screen, William finds out what documents he needs to answer the next set of questions about his income. Income information can be complex. This part of the marketplace application incorporates electronic verification to help applicants easily answer these questions as accurately as possible. When federal income tax data is available for a household member, and the confirmed income amount is high enough so that no family members applying for health coverage would be eligible for Medicaid or CHIP, this section is shortened to 2 simple questions. William enters his expected annual income of $40,150 in 2014. We ask one question about William's monthly income to see if he is eligible for Medicaid in the current month. Here, we use the figure $1,250 because this amount would make William eligible for Medicaid. William's monthly income will be more than $1,250 per month, so he is not eligible for Medicaid. Once we know household size and income, the system can determine which affordability program each applicant may qualify for. To see if William is eligible for lower costs on his monthly health plan premiums, we'll need to know whether William gets or could get affordable health coverage through his job. To determine this, we ask some questions about William's employer. In this section, William will be able to review everything he's entered and have a final chance to go back and make changes. On the Review Application page, William can review and print out all the information for his records. William then reads and agrees to a few additional statements. To get his eligibility results, when he's ready, William must review and agree to the list of statements on the Sign and Submit page. The statements are based on programs he may be eligible for. He can then sign his application electronically and officially submit it to the marketplace. On the application results page, William gets a list of programs for which he qualifies, and we let him know the next steps. Applicants can print the results page and have their eligibility determinations saved to their electronic account. In this example, William qualifies for a tax credit, a way to get lower costs on his monthly health plan premiums. By clicking on links on this page, William can also get more information such as how his eligibilities were determined and how to file an appeal. That's a quick look at the application process. With the application process complete, William can now enroll in a marketplace health plan and apply his tax credit right away.
And this next one will actually go over the plans and what it looks like in the premium tax credit. Did you sit down?
When will you be?
Welcome to...
No, down. Go down. There we go.
Welcome to the draft enrollment process for the health insurance marketplace on healthcare.gov. The marketplace is where you apply for health insurance coverage starting October 1st and receive step-by-step instructions on how to find and enroll in a plan that meets your needs and fits your budget. With the application process complete, our fictional single man from Arizona, William Doe, can enroll in a marketplace health plan. In this example, William qualifies to get lower costs on his monthly health plan premiums through a premium tax credit. An enroll to-do list helps guide William through the enrollment process and allows him to view tasks he has successfully completed, remaining open tasks, locked tasks to be completed before he can move on, tasks that can be done in parallel, no particular order. If he were to qualify for Medicaid and/or the Children's Health Insurance Program, these tasks would appear on the same enroll to-do list. If not applicable, William would not see these sections. William first reviews and learns the 3 ways that he can use his tax credit. William will then decide how much of the tax credit he'll use each month toward his premium. Use all, use part, use none. William is eligible for $83 each month and chooses to use the full amount towards his monthly premium. The enroll to-do list updates the tasks he has successfully completed and shows his next step. Next, William answers a question about his tobacco use. The enroll to-do list is updated and shows his next step in the process. Before William selects a plan, an overview of things to know about the health plans and how they are organized are easily explained to help him make an informed choice. William will select a plan from one of 5 categories that are based on how William and the plan expect to share the costs of care. The category William chooses affects how much his premium costs each month and what portion of the bill he'll pay for things like hospital visits or prescriptions. In general, the higher the premium, the lower the out-of-pocket costs. All plans will generally cover the same categories of essential health benefits, like doctor visits and emergency services. William can compare all his insurance options based on price, benefits, quality, and other features that may be important to him. He may select one or more metal level groupings before viewing plans. William selects to view plans from the bronze category and is then shown a variety of health plans in his area. William can use the filtering options on the plan results page to help narrow down his plan search. He selects 3 plans to compare. Consumers can select up to 12 plans to be compared. However, only 3 will display at a time side by side. The Plan Compare page displays his plan selection side by side. He can compare the costs and easily see what his monthly premium, deductible, and other out-of-pocket costs will be before he enrolls in a plan. To view more benefits and related costs, including coverage examples to illustrate costs associated with managing diabetes, he can scroll down the page and use the plus-minus signs to expand or close each section. He can click on Details to go to View a Specific Plan Details page. William can save plans to his account if he wants to continue shopping or review the information in more detail later. He can also print, download, or email the plan details information or click Enroll to enroll in a plan. William enrolls in the plan that meets his needs and fits his budget. The enroll to-do list shows the successful completion of all enrollment steps. William selects Pay Online and is redirected to the plan's website, where he can pay online or work with the plan's customer service to make arrangements to pay his first month's premium.
So this is a subsidiary calendar or calculator, and if you want later, you can go in the back and look at what premium tax credits will be available to you without having to fully sign in, or we could help you walk through the process if you want.